The history of surgery is not for the faint of heart. It is a journey through time that reveals the raw and often brutal attempts of early humans to understand and heal the body. It is a tale etched in blood, bone, and belief. These early attempts at surgery were often desperate measures, driven by the urgent need to alleviate suffering and save lives. Imagine a world without anesthesia, antiseptics, or even a basic understanding of human anatomy. In such a world, every cut, every incision was a gamble with life and death. This was the stark reality for our ancestors who faced illness and injury with a mixture of practicality and prayer. They relied on the limited knowledge they had, often turning to the divine for guidance and intervention. Yet, from these brutal beginnings, surgery emerged as a cornerstone of medicine, its evolution a testament to human curiosity and the enduring will to survive. Early surgeons were often seen as both miracle workers and butchers, their skills and tools rudimentary, but their determination unwavering. This journey through the dark origins of surgery will take us from the sun-baked deserts of ancient Egypt to the philosophical schools of Greece. In Egypt, the practice of surgery was intertwined with religious rituals, and the ancient Greeks began to lay the foundations of medical science. We will explore the crude tools and techniques employed by early healers, from flint knives to bronze scalpels. These instruments, though primitive, were the precursors to the sophisticated surgical tools we use today, and delve into the complex interplay of religion, superstition, and medical practice. In many cultures, surgery was seen as a sacred act performed by priests and shamans who invoked the gods to aid in the healing process. Prepare to be shocked, amazed, and perhaps even inspired by the resilience of the human spirit in the face of unimaginable suffering. The story of surgery is one of relentless innovation and adaptation, driven by the unyielding desire to overcome pain and prolong life. As we delve deeper, we will uncover the writings and teachings of early medical pioneers. These texts, often written on fragile scrolls, provide a window into the minds of those who dared to cut into the human body in search of cures. We will witness the passing of knowledge from one generation to the next, as early surgeons taught their apprentices the delicate art of healing. This transfer of knowledge was crucial in the gradual improvement of surgical techniques. The battlefield, too, played a significant role in the advancement of surgery. War injuries forced healers to innovate and adapt quickly, leading to new methods and tools that would eventually find their way into civilian medical practice. One of the earliest known surgical procedures is trepanation, the act of drilling or scraping a hole into the skull. This was believed to release evil spirits or relieve pressure, and remarkably, many patients survived this harrowing procedure. Alongside surgical techniques, early healers also relied heavily on herbal remedies and natural potions. These were used to treat wounds, reduce pain, and prevent infection, showcasing a holistic approach to healing. Despite the rudimentary nature of their tools and techniques, early surgeons were often revered by their communities. They were seen as brave individuals who dared to confront the mysteries of the human body and the uncertainties of life and death. Today we stand on the shoulders of these early pioneers. Modern surgery, with its advanced technology and sophisticated techniques, is a far cry from its brutal beginnings, yet the spirit of innovation and the quest to alleviate suffering remain unchanged. Join us as we trace the remarkable evolution of surgery from its ancient roots to the cutting-edge procedures of today. This is a story of blood, bones, and belief, a testament to the enduring human spirit and the relentless pursuit of knowledge and healing. The earliest evidence of surgical practice can be traced back to ancient Egypt. This civilization, known for its monumental architecture and rich culture, also made significant strides in the field of medicine. Ancient Egyptian surgeons were highly skilled and used a variety of tools made from bronze and other materials. They performed complex procedures, including trepanation, which involved drilling holes into the skull to treat head injuries and other ailments. Their medical knowledge was documented in various texts which have provided invaluable insights into their practices. And Mesopotamia. These civilizations, flourishing along fertile river valleys, laid the groundwork for medicine as we know it. Mesopotamia, often referred to as the cradle of civilization, was home to some of the earliest known medical practitioners. The Mesopotamians developed a comprehensive understanding of the human body and its ailments, and their medical practices were deeply intertwined with their religious beliefs. They believed that diseases were caused by supernatural forces and sought to appease the gods through various rituals and offerings. Egyptian medical texts, such as the Edwin Smith Papyrus, provide detailed accounts of surgical treatments for wounds, fractures, and dislocations. This ancient document, dating back to around 1600 BCE, is one of the oldest known medical texts and offers a glimpse into the advanced medical knowledge of the time. It describes various surgical techniques and the use of different tools, as well as the importance of cleanliness and hygiene in preventing infections. The Egyptians also had a deep understanding of anatomy, which they gained through the practice of mummification. Meanwhile, in Mesopotamia, the Code of Hammurabi established legal precedents for surgical procedures, outlining both fees and punishments for practitioners. This ancient legal code, dating back to around 1754 BCE, is one of the earliest known sets of laws and includes specific regulations regarding medical practice. It set standards for the quality of care and held surgeons accountable for their actions, with severe penalties for malpractice. This legal framework helped to ensure that medical practitioners adhered to high standards of professionalism and ethics. These early civilizations recognized the importance of surgery in addressing trauma and disease. They developed a range of techniques to treat various conditions, from setting broken bones to performing amputations. Their surgical practices were often accompanied by the use of herbal remedies and other natural treatments, which helped to alleviate pain and promote healing. The knowledge and skills of these ancient surgeons were passed down through generations, forming the foundation for future medical advancements. They developed surprisingly sophisticated methods for their time, setting the stage for future advancements. The contributions of ancient Egypt and Mesopotamia to the field of surgery cannot be overstated. Their pioneering efforts laid the groundwork for the development of modern surgical techniques and practices. By studying their achievements, we gain a deeper appreciation for the ingenuity and resourcefulness of these early civilizations, and we are reminded of the enduring legacy of their contributions to the field of medicine. The ancient Greeks, renowned for their philosophical and scientific contributions, also made significant strides in the field of surgery. Their advancements were not just limited to abstract thought, but extended to practical applications that have influenced modern medicine. Hippocrates of Kos, often hailed as the father of medicine, emphasized observation, diagnosis, and a rational approach to treatment. His methods were revolutionary for the time, moving away from mystical explanations and towards a more systematic study of the human body and its ailments. He rejected the notion that illness was caused by supernatural forces, advocating instead for a more empirical understanding of the human body. This shift in perspective was monumental, as it laid the groundwork for future generations of physicians to build upon. The Hippocratic Corpus, a collection of medical texts attributed to Hippocrates and his followers, contains treatises on surgery, including procedures for wound management, bone setting, and even trepanation, the drilling of holes in the skull. These texts were among the first to systematically document medical knowledge and surgical techniques, providing a valuable resource for both contemporary and future medical practitioners. While the efficacy of some of these techniques is debatable, the Greeks' emphasis on observation and logic laid a crucial foundation for the scientific development of surgery. Their approach to medicine was holistic, considering not just the physical symptoms, but also the patient's environment and lifestyle. This comprehensive view of health and disease was ahead of its time and continues to resonate in modern medical practice. Beyond Hippocrates, other Greek physicians like Galen further advanced medical knowledge. Galen's extensive writings on anatomy and physiology were based on careful dissections and observations, and his work remained influential for centuries. The legacy of these early medical pioneers is evident in the principles of modern surgery, which still prioritize careful observation, detailed documentation, and a rational approach to treatment. Today, the principles established by Hippocrates and his contemporaries continue to underpin medical education and practice. The Hippocratic Oath, a pledge of ethical medical practice, is still taken by medical graduates around the world, symbolizing the enduring impact of ancient Greek medicine. As we look back at the contributions of these early physicians, we gain a deeper appreciation for the foundations of modern surgery and the timeless quest to understand and heal the human body. The journey from Hippocrates to modern surgery is a testament to the enduring power of observation, logic, and the relentless pursuit of knowledge. It reminds us that the quest for medical understanding is a continuous journey, building on the wisdom of the past to improve the health and well-being of future generations.